Hello, everybody. Thank you for joining us today, members of the press, our community, our board, and our staff, to our press conference today to share recent events. Kevin Spiegel, our Vista Health System CEO, will be providing us with a statement and followed up by questions that he will take. Thank you.
Thank you so much and welcome. I have my team with me. This is really good. Thank you so much for being here. Members of the press, our board of directors, the medical staff, the nursing staff, and all the associates here at Vista Hospital. Thank you so much for being part of this. I would like to start by saying that our entire team and I wholeheartedly care about our patients, colleagues, and the community. I'm going to put on my glasses. We are devastated by the recent tragedy that occurred this past week, and we extend our sympathy to the patient's family and friends. While we are unable to comment on any specific health information due to the federal regulation of HIPAA, we can, in fact, confirm that Vista Health System reported the incident to state and regulatory agencies in a timely manner, and we are cooperating fully with them as well as local law enforcement. It is disappointing and truthfully unprecedented that the Lake County Coroner's Office would choose to hold a press conference without our knowledge nor being given the opportunity to participate. It is important to work in a detailed, collaborative, and expedient manner, not only out of the respect for the family, but the sake of our community trust. The biased comments and the way this incident has been handled by the coroner's office did not meet these expectations. We are especially concerned about the nurse anesthetist coroner's comments at the press release appearing to be absolutely retaliatory and a clear reflection of extreme disdain on the Vista Health System. Further evidence can be cited by referencing a dedicated Facebook page that she has founded for the last year. The totality of her actions include using her position as an elected official to influence the public's opinion and bolster support for personal vendetta has been occurring for approximately 1 year. Additionally, the coroner's comments not only were inaccurate, but also were not in the best interest of our community here. Given a clear bias demonstrated in this case, we have filed a request to the court for an emergency injunction to have her removed from this investigation and replaced with an impartial party. Additionally, we are hopeful that this may facilitate the ongoing investigation's ability to proceed without interference. Regarding the suggestion that layoffs or furloughs have compromised patient safety, we want to be unequivocal. These claims are entirely unfounded and absolutely false. None of these roles affected or impacted our commitment to the highest standards of patient care and safety. In summary, Vista Health System expects a thorough, fair, and unbiased investigation to be conducted in order to bring clarity and closure to this heartbreaking situation. Again, our thoughts remain with the patient's family, friends, and loved ones during this incredibly difficult time. We would like to take this moment to express our appreciation for our dedicated healthcare team. Those compassion has been unwavering during this incident, and if you could see by the clinicians behind you of their personal commitment to this community and the care to every single patient that this healthcare system sees. This weighs heavily on all of us, and we are committed doing everything we can do to ensure transparency and accountability and healing of this patient's family and our staff. At this point, I'm going to open it up to questions.
Quick question. Have you furloughed employees in the past year? And if so, how many?
We furloughed, I think it's, Anthony, about 27.
In what time span?
69, now 78.
Right?
69 employees were
Oh,
furloughed,
so-
and then there was a
Additional
second
9
wave.
more. Yeah.
Can you clarify that? I'm sorry. Maybe
69 employees were furloughed. And
past year?
yes,
An
And
addition of
then
9
seven-
more too.
and additionally,
Addition of 9 more, so 78 total.
An additional 9 more. What's the range of what those employees did here?
from anything from patient transport to what are the majority of them?
I don't have the breakdown right now, but it was in areas where staffing was more than what we needed.
Don't mean to dwell on that subject, but just to clarify, the coroner in a news conference the other day speculated that some of those furloughed employees, as you're aware, might have been in patient safety situations that could have prevented this unfortunate situation. Could you respond to that?
Yeah, I think I have. It in this situation, every possible way to provide care to this patient was provided by registered nurses at the bedside of this patient. And in any way, shape, or form was anything missing at this point. Now, it's an ongoing investigation. We have our internal investigation going on, as well as from the state and federal agencies doing the same. But I think it's going to be consistent that the highest level of care is being provided now and has been provided.
When a patient goes missing, what are the internal protocols that take place?
The protocol is if a patient goes missing, hopefully there was interaction with the patient, and the staff would call security. Security would do a sweep, and then we would call the police to see if they could help us as well if the patient left if necessary. But the thing is, patients have the right, whether we agree or not agree, to leave a hospital at any time. We don't use restraints or chemical restraints. It's not a jail. Patients have the right to leave, even if it's in the middle of the night.
Without going into the results of the investigation, can you say, is one of the things that's being investigated trying to determine how she got onto that, through the door, onto that portion of the roof?
Yeah, that's directly in the realm of the investigation by the police and the regulatory agencies, so I'm not going to be able to tell how she was able to do it, but I think they have a good idea how that happened.
Obviously, it's a concern to the hospital, though, to prevent it from happening again.
Absolutely. Absolutely.
What measures are you taking immediately now to make sure that nothing like that happens?
I can't really get into that right now, but I can tell you that we have initiated immediate corrective actions on the physical plan so that nobody can access that room.
It's very difficult, I'm sure, for you to respond to something that hasn't quite happened yet, but you're aware that an attorney for the family is filing a lawsuit later today, is having a news conference in about an hour.
Yes. And I think that's clearly within the right of families to do that, and that appears to be absolutely good practice, and you know, that's something that should be happen, you know, in good time. But yeah, that's totally appropriate.
I'm sure that this is part of the investigation, but do you believe as of right now that the sweep happened, the security happened here, or that police were notified in an ample amount of time?
Yeah, I mean, you know, we're confident that the way the staff handled this situation was 100% appropriate. You know, the police were notified, the code went out over the loudspeaker. You know, I'm proud to be the president and CEO of this hospital because I know that the staff here are absolutely dedicated to patient care, and they follow the policies and procedures to the letter, and that's warming. I would come here myself and my family anytime because this is a great organization.
I think you just touched on what I was going to ask, but there was an announcement at some point during the evening over the...
Immediately.
Okay. That was over the speaker system in
Yep.
the hospital?
Yeah, we sent out a code.
Does anyone else have anything to share that they'd like to say?
Thank you
Thank
very
you.
much.
Everybody, thank you so much. The staff that are here, thank you. God bless you for taking care of this community. I appreciate you so much, and I know that you've really been dedicated, not only for now, but continuing. So everybody, thank you so much for your commitment to Vista Health System. Good afternoon.